Consent for OGD, biopsy, and dilatation under general anesthesia. Your patient is a 60-year-old man with a history of smoking and alcohol use. He presents with dysphagia, difficulty swallowing. Your consultant has gone for a meeting, and you have been tasked with obtaining consent for an esophagogastroduodenoscopy, OGD, biopsy, and dilatation under general anesthesia. Your task is to explain the procedure, its risks, benefits, and alternatives to the patient, and to ensure the patient understands and consents to the procedure.
Hello, I'm Dr. Nate. How are you feeling today?
I'm okay, a bit anxious about all this.
I understand that it can be worrisome. We're here to take care of you. Today, I'd like to talk about the procedure your consultant has recommended, which is an esophagogastroduodenoscopy, often referred to as an OGD. It also involves a biopsy and a dilatation. Do you know about this procedure?
Not much. They mentioned it, but I didn't understand what it is.
That's perfectly okay. Let me explain it to you. The OGD is a procedure where we use a thin, flexible tube with a camera on the end to look at your esophagus, stomach, and the first part of your small intestine. The biopsy part means that we may take a small tissue sample for further analysis, and the dilatation is a procedure to widen a part of your esophagus if it's too narrow, which might be causing your difficulty swallowing. All of this will be done under general anesthesia, so you will be asleep and won't feel any pain. Does that make sense so far?
Yes, it does. But why do I need this procedure?
The main reason is your symptom, difficulty swallowing. It could be due to a narrow esophagus, which can happen for various reasons. By performing the OGD and potentially a dilatation, we can get a clearer picture of what's going on inside and treat it accordingly. The biopsy can help us rule out any other conditions.
What are the risks of this procedure?
Like all medical procedures, there are some risks, although they are relatively rare. They include possible reactions to anesthesia, bleeding, especially if a biopsy or dilatation is performed, infection, and a very small risk of perforation, which is a tear in the esophagus or stomach. It's important to remember that we have experienced medical professionals who will take every precaution to minimize these risks.
Are there any alternatives?
There are some alternatives such as medication or lifestyle changes, but these generally only provide temporary relief or are less effective. Given your symptoms, the OGD with a possible biopsy and dilatation is the most direct way to diagnose and potentially treat your condition.
I see. I'm still a bit anxious, but I understand it's important.
It's perfectly normal to feel anxious. We're here to support you. Do you feel comfortable giving your consent to proceed with the procedure?
Yes, I think I understand it well enough now. Let's go ahead with it.
Thank you for your understanding and cooperation. I'll prepare the consent form for you to sign. And remember, if you have any more questions or concerns, don't hesitate to let us or the nursing staff know. We're here for you.